Have you ever felt that annoying sensation of a pebble in your shoe, only to find out there's nothing there when you check? You're not alone, and it's not just in your head. This feeling, often described as having a rock in your shoe, can be perplexing and irritating. My name is Dr. Andrew Schneider. I'm a podiatrist in Houston, Texas, with over 25 years of experience treating foot and ankle problems. Welcome back to our Ball of Foot 101 series. Today we're diving deep into one of the most commonly misunderstood causes of ball of foot pain, Morton's neuroma and other nerve-related conditions. If you've been told you've had a neuroma, or you're experiencing burning, tingling, or that mysterious rock in your shoe sensation, this module is specifically for you. By the end of today's discussion, you'll understand exactly what a Morton's neuroma is, how it differs from other conditions, and most importantly, what treatment options are available to get you back to walking pain-free. Before we get into the details, I want to remind you I've written a comprehensive book all about ball of foot pain, including an entire section on Morton's neuroma. You can get it completely free at www.balloffootbook.com. Also, if you find this information helpful, please like this module, hit the subscribe button, and share on social media. This will help others who are struggling with foot pain find the relief they need. Let's start by understanding exactly what a Morton's neuroma is, because there's a lot of confusion about this condition. A Morton's neuroma is not actually a tumor, despite what the name might suggest. The term neuroma might be misleading. What we're really dealing with is a thickening and inflammation of the tissue that surrounds a nerve in the ball of the foot. This most commonly occurs between the third and fourth toes, although it can happen between other toes as well. Think of it this way. You have nerves that run between each of your metatarsal bones, providing sensation to your toes. When these nerves become compressed and irritated over time, the tissue around them starts to thicken as a protective response. This thickened tissue is what we call a Morton's neuroma. The compression typically happens because the nerve gets squeezed between the adjacent metatarsal bones and the ligaments that connect them. It's like having a rope that gets pinched between two rocks. Over time, the constant pressure causes damage and inflammation. So what causes this compression in the first place? There are several common culprits. Tight shoes, especially with narrow toe boxes or high heels, are major contributors. When your toes are squeezed together, it increases the pressure on the nerves running between your metatarsal bones. Women are affected 4 times more often than men, largely because of footwear choices. Overpronation, which is when your foot rolls inward excessively when you walk, can contribute to neuroma formation. The abnormal motion can cause the metatarsal bones to move in a way that increases pressure on the nerves. Certain foot shapes, like having a high arch or longer second toe, can also predispose you to developing a neuroma. High impact activities, especially those that involve repetitive pressure on the ball of the foot, can trigger neuroma development. I see this frequently in runners, dancers, and people who participate in sports that require quick direction changes. Now let's talk about the symptoms, because this is where things get confusing. The classic symptom of a Morton's neuroma includes a burning sensation in the ball of your foot that may radiate into your toes. Many patients describe tingling or numbness of the affected toes. That rock in your shoe feeling I mentioned earlier is extremely common. The pain typically gets worse when you're wearing tight shoes, and often improves when you take your shoes off and massage your foot. You might notice that the pain is worse after you've been on your feet for extended periods. Some patients experience a sharp shooting pain that can be quite intense. Interestingly, there's usually very little to see externally. Unlike other foot conditions, a Morton's neuroma rarely causes visible swelling, redness, or bruising. Sometimes you might notice that your toes spread apart slightly more than usual, but that's about it. Here's where it gets tricky. These symptoms can be very similar to other conditions that affect the ball of the foot. This is why proper diagnosis is so crucial, and why many people end up being misdiagnosed or treated for the wrong condition. Let's talk about the most common misdiagnoses. The first is capsulitis, which we discussed in our first module. Capsulitis is inflammation of the joint capsule, usually affecting the second toe joint. While both conditions can cause pain in the ball of the foot, there are key differences. With capsulitis, the pain is typically more localized to the area behind the specific toe, usually the second toe. The pain often responds to direct pressure. If I press on the joint, it reproduces your pain. With a Morton's neuroma, the pain is usually between the toes rather than directly behind one toe, and it often doesn't respond as clearly to direct pressure. Capsulitis pain is often described as deep aching sensation, while neuroma pain is more commonly described as burning or tingling. Also with capsulitis, you might notice that the affected toe begins to drift towards your big toe over time, which doesn't happen with a neuroma. Another condition that's often confused with a Morton's neuroma is a plantar plate tear. The plantar plate is a ligament on the bottom of your toe joint that provides stability. When this ligament tears, it can cause the toe to become unstable and start to lift up and drift to the side. The key difference here is that plantar plate tears usually cause visible change in toe position. You're actually seeing the toe starting to move out of its normal alignment. With a Morton's neuroma, your toes typically stay in their normal position. Also, plantar plate tears often cause pain that's worse when you try to bend the toe up, while neuroma pain is more related to pressure from the sides. So how do we make an accurate diagnosis? In my office, I use several specific tests to identify Morton's neuroma. The most important is something called the Mulder's click test. During this test, I squeeze the sides of your foot together while pressing up on the area between your toes. If you have a neuroma, this often produces a clicking sensation and reproduces your pain. I often perform what's called a squeeze test, where I compress the forefoot from side to side. This typically reproduces the pain if you have a neuroma. The location of the pain during these tests help me determine exactly which nerve is affected. Diagnostic ultrasound has become an invaluable tool for confirming the diagnosis. Unlike x-rays, which only show bones, ultrasound allows me to see the soft tissue, including the nerves. I can actually visualize the thickened nerve tissue and measure its size. This is important because the size of the neuroma often influences our treatment approach. Sometimes I'll use a diagnostic injection. If I inject a small amount of local anesthetic around the suspected nerve and your pain goes away temporarily, that confirms the diagnosis. This test also gives us valuable information about how you might respond to other injection treatments. Now let's talk about the treatment options, because this is where things have really evolved in recent years. We have more effective treatment options available now than ever before, including several that can help you avoid surgery entirely. Conservative treatment is always our first approach. The most important thing is addressing the mechanical factors that cause the neuroma in the first place. I mean switching to wider shoes with lower heels and adequate cushioning. I know this can be challenging, especially for women who are used to wearing fashionable shoes, but it is absolutely crucial for healing. Metatarsal pads are extremely helpful for many patients. These are small cushions that you place in your shoes just behind the ball of your foot. They work by spreading the metatarsal bones apart, which reduces pressure on the nerve. The key is proper placement. They need to be positioned correctly to be effective. Activity modification is also important during the healing phase. If certain activities are aggravating your symptoms, it's worth taking a temporary break from them while we work on getting the inflammation under control. Custom orthotics can be very effective for Morton's neuroma, especially when designed with specific forefoot modifications. We can incorporate metatarsal support and pressure relief areas to keep the metatarsal bones properly spaced and reduce pressure on the affected nerve. When conservative measures aren't providing adequate relief, we have several injection options. Corticosteroid injections can provide significant temporary relief by reducing inflammation around the nerve. While these injections don't cure the neuroma, they can provide enough relief to allow other treatments to be more effective. Extracorporeal shockwave therapy has shown excellent results for Morton's neuroma. This non-invasive treatment uses acoustic waves to stimulate healing and reduce inflammation in the affected nerve tissue. The treatment is painless and can be performed in the office. Many of my patients experience significant pain relief after just a few sessions. For patients who don't respond to conservative treatments or injections, surgery might be necessary. The most common surgical procedure involves removing the affected portion of the nerve. While this is generally effective in eliminating pain, it does result in a permanent numbness between the affected toes. I want to emphasize that surgery should really be a last resort. With the effective conservative and regenerative treatments we have available today, the vast majority of patients can achieve significant pain relief without surgery. One thing that's important to understand is that not all forefoot nerve pain is Morton's neuroma. I see patients regularly who have been told they have a neuroma when they actually have a different condition entirely. This is why proper diagnosis is so crucial. For example, nerve entrapment can occur at other locations in the foot, causing similar symptoms. Tarsal tunnel syndrome, which is compression of the main nerve that runs behind your ankle, can cause burning and tingling in the forefoot that mimics a neuroma. Sometimes what appears to be a neuroma is actually referred pain from a problem higher up in your leg or even in your back. This is why a comprehensive evaluation is so important. There's also systemic conditions that can cause nerve-related foot pain. Diabetes, for instance, can cause peripheral neuropathy that affects your feet. Vitamin deficiencies, particularly B vitamins, can also cause nerve symptoms. These conditions require very different treatment approaches than Morton's neuroma. This is why I always take a complete medical history and perform a thorough examination before making a diagnosis. Sometimes blood tests or other studies are necessary to rule out systemic causes for nerve pain. Prevention is always better than treatment. If you have Morton's neuroma treated successfully, there are things you can do to prevent it from coming back. Proper footwear is crucial. Choose shoes with adequate width. Avoid high heels when possible. If you must wear high heels for work or special occasions, try to limit the time you spend in them. Custom orthotics can be very helpful for prevention, especially if you have foot mechanics that predispose you to neuroma formation. Regular foot exercises to maintain flexibility and strength can also be beneficial. Pay attention to early warning signs. If you start to notice any burning, tingling, or that rock in your shoe sensation, don't ignore it. Early treatment is much more effective than waiting until the condition becomes severe. As we wrap up this second module in our Ball of Foot Pain 101 series, I want you to remember that not all forefoot nerve pain is a Morton's neuroma, and a proper diagnosis is crucial for effective treatment. The good news is that we have more treatment options available today than ever before, including advanced regenerative therapies that can help you avoid surgery. If you found this module helpful, please take a moment to like it, comment below with any questions you might have, and share it on social media to help others who might be struggling with similar pain. Be sure to hit the subscribe button so you won't miss the next module in this series. Don't forget to download your free copy of my comprehensive guide to ball of foot pain at www.balloffootbook.com. It includes detailed information about Morton's neuroma and about the treatment option we discussed today. If you're experiencing nerve pain in the ball of your foot and want a proper diagnosis before pursuing treatment, I encourage you to schedule an appointment. Not all forefoot nerve pain is a neuroma, so getting the right diagnosis is a first step towards effective treatment. The link to request an appointment is in the description below. Thanks so much for watching, and have a great day.